There is a quiet truth about the human body that most people discover only after it is too late. The organs that serve you most faithfully are often the ones you think about least, until they begin to fail. Your kidneys, in particular, operate in complete silence, filtering your blood day and night, regulating your blood pressure, maintaining your bone health, and performing dozens of other tasks you never witness and rarely appreciate. And here is what makes this relevant to you right now. The habits that damage kidneys are not dramatic or obviously dangerous. They are the small, repeated choices that seem harmless in the moment, choices you may have made today, yesterday, and for years before. What we are going to explore together is not a list of warnings meant to frighten you, but rather a map of understanding. Because once you see clearly how these silent filters work and what actually strains them, the path to protecting them becomes not only obvious, but entirely within your control. You are listening to the Longevity Library, where we archive the wisdom of healthy aging. The Silent Strain. Understanding Kidney Health After 60. Introduction. The kidneys perform an extraordinary range of functions that extend far beyond simple waste removal. These fist-sized organs, located just below the rib cage on either side of the spine, filter approximately 120 to 150 quarts of blood daily, producing 1 to 2 quarts of urine. But their role in maintaining overall health is considerably more complex. The kidneys regulate blood pressure by controlling fluid volume and releasing hormones. They maintain the delicate balance of electrolytes, including sodium, potassium, and phosphorus. They activate vitamin D for bone health and produce erythropoietin, a hormone essential for red blood cell production. After age 60, kidney function naturally begins a gradual decline. The number of functioning nephrons, the microscopic filtering units within each kidney, decreases. Blood flow to the kidneys diminishes. The kidneys themselves may shrink slightly in size. This natural aging process makes the kidneys more vulnerable to additional stressors. What might have been manageable at age 50 can become problematic at age 65 or 70. Understanding this age-related vulnerability is the foundation of kidney protection. The challenge with kidney disease lies in its silence. Early stages typically produce no symptoms whatsoever. By the time noticeable signs appear, swelling in the ankles, fatigue, changes in urination, significant damage has often already occurred. Many individuals lose 60 to 70% of kidney function before becoming aware of any problem. This reality makes prevention and early detection essential components of health management after 60. Section 1. The urinary system and kidney function. The importance of complete bladder emptying. The relationship between the bladder and the kidneys is direct and consequential. The bladder serves as a temporary storage reservoir for urine produced by the kidneys. When functioning properly, this system operates with remarkable efficiency. The ureters transport urine from the kidneys to the bladder through peristaltic waves, muscular contractions that move urine in one direction. The bladder expands as it fills, sending signals to the brain when approximately half full. Complete bladder emptying during urination ensures that urine does not remain stagnant in the urinary tract. Urine that remains in the bladder for extended periods creates an environment conducive to bacterial growth. Human urine, while typically sterile, contains nutrients that bacteria can utilize. When urine stagnates, bacterial populations can multiply. The most common pathogens involved in urinary tract infections, particularly Escherichia coli from the digestive tract, can ascend from the urethra into the bladder when given sufficient time and opportunity. When bacteria colonize the bladder, the result is cystitis, or bladder infection. The symptoms: burning during urination, frequency, urgency, lower abdominal discomfort, are uncomfortable but generally treatable. The greater concern arises when these infections are not promptly addressed. Bacteria can migrate upward through the ureters, the narrow tubes connecting bladder to kidneys. Once bacteria reach the kidneys, the infection becomes pyelonephritis, a significantly more serious condition. Pyelonephritis involves infection within the delicate structures of the kidney itself. The body's inflammatory response to this infection can cause swelling, which may compress the tiny tubules and capillaries within the kidney. Repeated episodes of pyelonephritis produce scarring. Unlike many other tissues in the body, kidney tissue does not regenerate effectively. Each scar represents permanently lost function. The nephrons within scarred areas cease filtering entirely, placing additional burden on remaining healthy nephrons. Complete bladder emptying requires both attention and proper technique. Rushing through urination often results in residual urine remaining in the bladder. The bladder muscles require a few moments to contract fully. Leaning slightly forward while seated can improve bladder emptying by altering the angle of the urethra. Double voiding, urinating. Waiting a few moments, then attempting to urinate again, can help ensure the bladder has emptied completely. The impact of delayed urination. The habit of delaying urination when the urge arises places stress on the entire urinary system. The bladder is a muscular organ designed to expand and contract. When urine is held beyond the point of initial urge, the bladder wall stretches beyond its optimal capacity. The muscle fibers within the bladder wall can become overstretched and weakened over time, similar to how repeatedly overfilling a balloon affects its elasticity. This stretching has several consequences. First, a chronically overstretched bladder may not contract as effectively during urination, leading to incomplete emptying even when the individual attempts to void completely. The residual urine that remains becomes a reservoir for bacterial growth. Second, the sensation of bladder fullness may become blunted, causing individuals to delay urination even longer, perpetuating the cycle. The pressure generated by a full bladder can also affect the kidneys indirectly. When the bladder becomes overly full, pressure can transmit backward through the ureters. Under normal circumstances, the junction where the ureters enter the bladder prevents backflow. Prolonged or extreme pressure can compromise this one-way valve mechanism. When urine flows backward toward the kidneys, a condition called vesicoureteral reflux, it can carry bacteria with it and expose kidney tissue to pressure damage. The practical approach to maintaining urinary health involves simple behavioral adjustments. Responding to the first urge to urinate, rather than waiting for convenience, protects both bladder and kidneys. Ensuring complete emptying during each void reduces stagnation. For individuals with mobility challenges that make frequent bathroom trips difficult, strategic planning of fluid intake may be necessary. But this should be discussed with a healthcare provider rather than simply holding urine for extended periods. Section 2. Medications and kidney stress. Understanding NSAID mechanism of action. Nonsteroidal anti-inflammatory drugs represent one of the most commonly used medication classes worldwide. Available over the counter and by prescription, these medications provide effective relief for pain, inflammation, and fever. Ibuprofen, naproxen, and higher-dose prescription versions are familiar to most adults. Their accessibility and effectiveness, however, can mask their potential for harm when used improperly. The mechanism by which NSAIDs relieve pain also explains their effect on the kidneys. These medications work by inhibiting enzymes known as cyclooxygenases, or COX enzymes. These enzymes are responsible for producing prostaglandins, hormone-like substances involved in pain and inflammation signaling. By reducing prostaglandin production, NSAIDs decrease pain perception and inflammatory responses throughout the body. Prostaglandins, however, serve functions beyond pain signaling. Within the kidneys, Specific prostaglandins play a crucial role in maintaining adequate blood flow. They act as vasodilators, meaning they help keep blood vessels open and relaxed. This is particularly important in the kidneys because blood flow here must remain constant and sufficient to support the high filtration demands placed on these organs. When NSAIDs block prostaglandin production, the blood vessels supplying the kidneys constrict. Blood flow to kidney tissue decreases. Nephrons receive less oxygen and fewer nutrients than they require for optimal function. In the short term, this can produce a temporary, reversible decrease in kidney function with repeated exposure. However, the effects accumulate and may become permanent. Acute kidney injury versus chronic damage. The kidney's response to reduced blood flow can manifest in two distinct patterns: acute kidney injury and chronic kidney damage. Acute kidney injury represents a sudden decline in kidney function, typically occurring over hours or days. In the context of NSAID use, this often happens when an individual takes these medications while already dehydrated, ill, or taking other medications that affect kidney blood flow. The combination of reduced fluid volume and medication-induced vessel constriction can precipitate a sharp decline in filtration. Acute kidney injury from NSAIDs may be reversible if recognized promptly and the medication discontinued. The kidneys, when blood flow is restored, can often recover function. However, even reversible acute injuries may leave some residual damage. Each episode of acute injury stresses the kidney's repair mechanisms and may contribute to cumulative loss of function over time. Chronic damage from long-term NSAID use follows a different pattern. Repeated, ongoing constriction of blood vessels within the kidneys leads to a condition called chronic interstitial nephritis. This term describes inflammation and scarring of the kidney tissue itself, particularly the spaces between the filtering tubules. Over months and years of regular NSAID use, this scarring spreads, unlike acute injury, which may improve with medication cessation. Chronic interstitial nephritis represents permanent structural change. The risk associated with NSAIDs increases with age for several reasons. Natural age-related decline in kidney function means less reserve capacity to absorb medication-related stress. Older adults are more likely to take multiple medications, increasing the potential for drug interactions. Dehydration becomes more common due to decreased thirst sensation and medication effects. For these reasons, NSAID use after 60 requires particular caution. Safe medication practices. Guidelines for safe NSAID use center on duration, dose, and context. The shortest possible duration of use minimizes kidney exposure to these medications. For acute pain lasting a few days, short-term NSAID use at recommended doses poses minimal risk for most individuals with healthy kidneys. The concern arises when use extends to weeks, months, or years without medical supervision. Dose considerations involve both the amount taken at one time and the cumulative daily total. The lowest effective dose should always be used. Many individuals assume that if one tablet provides partial relief, 2 tablets will provide complete relief. This reasoning overlooks the plateau effect of pain medication and increases kidney exposure unnecessarily. Package directions provide maximum daily limits for a reason, and these should not be exceeded. Context encompasses factors that modify individual risk. Dehydration significantly amplifies NSAID effects on kidney blood flow. Taking these medications with inadequate fluid intake compounds their vasoconstrictive effects. Concurrent use of other medications that affect kidney function, such as certain blood pressure medications or diuretics, requires careful consideration. Existing health conditions, particularly diabetes, hypertension, or known kidney disease, increase vulnerability to NSAID-related damage. Alternatives to NSAID pain management deserve consideration, particularly for chronic pain conditions. Heat and cold therapy can provide substantial relief for many musculoskeletal complaints. Physical therapy addresses underlying mechanical issues rather than simply masking pain. Topical analgesics deliver medication locally without the systemic effects of oral NSAIDs. Acetaminophen, while less effective for inflammation, provides pain relief without the same kidney effects as NSAIDs, though it carries its own risks at excessive doses. For individuals who require ongoing NSAID therapy under medical supervision, regular monitoring of kidney function provides a safety net. Blood tests measuring creatinine and estimated glomerular filtration rate can detect declining function before symptoms appear. If these markers show deterioration, medication adjustments can be made before permanent damage occurs. Section 3. Hydration and kidney function. The role of water in kidney filtration. The kidney's primary function, filtering waste from blood, depends fundamentally on adequate water availability. Blood consists largely of water, carrying dissolved waste products, nutrients, and cells throughout the body. As blood passes through the kidneys, specialized structures filter out waste products while retaining useful substances. This process requires sufficient fluid volume to maintain blood pressure within the filtering units and to dissolve waste products for excretion. When water intake falls below what the body requires, the kidneys must concentrate urine to conserve fluid. Concentrated urine contains higher levels of waste products dissolved in less water. While this conservation mechanism serves an important purpose during temporary dehydration, chronic low fluid intake keeps the kidneys in a persistent state of concentration that stresses their function. The relationship between hydration and kidney stone formation illustrates this principle clearly. Kidney stones develop when certain minerals and salts in urine become so concentrated that they crystallize and bind together. Calcium oxalate stones, the most common type, form when calcium and oxalate reach supersaturation in urine. Adequate fluid intake dilutes these substances, reducing the likelihood that they will reach concentrations sufficient for crystal formation. Uric acid stones similarly depend on urine concentration. When urine becomes highly concentrated and acidic, uric acid can precipitate out of solution, forming crystals that may aggregate into stones. Adequate hydration maintains urine volume and can help maintain optimal urine pH, both of which reduce stone risk. Recognizing dehydration after 60. The sensation of thirst changes with age. Older adults typically experience diminished thirst response compared to younger individuals. This physiological change means that waiting until feeling thirsty before drinking water means dehydration has already begun. The body's fluid balance has already shifted negative before the thirst signal registers. Medication side effects further complicate hydration status. Many common medications, including those for blood pressure, allergies, and mood disorders, can cause dry mouth or otherwise affect fluid intake. Diuretics, prescribed for hypertension or heart failure, increase urine output and can lead to dehydration if fluid intake does not keep pace. Physical changes also affect hydration. Reduced mobility may make obtaining water more difficult. Fear of incontinence or frequent urination may lead some individuals to restrict fluid intake intentionally. These behavioral factors, combined with physiological changes, create vulnerability to chronic mild dehydration. Urine color provides a practical, accessible indicator of hydration status. Pale yellow to clear urine generally indicates adequate hydration. Dark yellow or amber urine suggests concentration and the need for increased fluid intake. This simple visual check, performed throughout the day, offers immediate feedback on hydration status without requiring medical equipment or expertise. Practical hydration strategies. Establishing consistent hydration habits proves more effective than attempting to drink large volumes at once. Spreading fluid intake throughout the day allows the kidneys to process water steadily rather than facing sudden fluid loads. Starting the day with a glass of water addresses the mild dehydration that typically develops overnight. Drinking water with each meal and between meals maintains steady hydration. Water remains the optimal choice for hydration. While other beverages contribute to fluid intake, many contain substances that may counteract hydration benefits. Sugary drinks add caloric load and may affect blood sugar regulation. Caffeinated beverages have mild diuretic effects, though regular consumers develop tolerance to this effect. Alcohol actively promotes fluid loss and should not be relied upon for hydration. Food sources contribute meaningfully to total fluid intake. Many fruits and vegetables have high water content. Cucumbers, lettuce, celery, watermelon, and citrus fruits provide water along with nutrients and fiber. Soups and broths offer hydration with additional nutritional value. Including these foods in daily meals supports overall hydration status. For individuals who struggle to drink plain water, enhancement strategies may help. Adding lemon, lime, or cucumber slices provides subtle flavor without sugar. Herbal teas, served hot or iced, contribute to fluid intake while offering variety. Sparkling water provides sensory interest for those who find still water unappealing. The goal remains adequate total fluid intake, and finding palatable approaches supports consistency. Section 4. Dietary factors affecting kidney health. Sodium and blood pressure regulation. The relationship between sodium intake, blood pressure, and kidney function represents one of the most well-established connections in health. Sodium is an essential mineral, necessary for nerve transmission, muscle contraction, and fluid balance. The challenge lies not in sodium itself, but in the quantities consumed in modern diets. When sodium enters the bloodstream, it attracts and holds water. This osmotic effect increases the total volume of blood circulating through the vascular system. Increased blood volume means increased pressure against artery walls. The heart must work harder to pump against this higher pressure, and the kidneys must work harder to filter the expanded blood volume while attempting to excrete excess sodium. The kidneys possess sophisticated mechanisms for regulating sodium balance. Specialized cells detect sodium concentration in blood and trigger hormonal responses that adjust how much sodium is excreted in urine. When sodium intake is chronically high, these regulatory systems operate continuously at elevated levels. Over time, this sustained effort contributes to structural changes within the kidneys. High blood pressure damages the kidneys through mechanical forces. The delicate capillaries within the glomeruli, the clusters of tiny blood vessels where filtration begins, are designed for efficient exchange, not high-pressure flow. When blood pressure remains elevated, these capillaries stretch. Their walls thicken in response to the increased pressure, a process called hypertrophy. Thickened walls are less efficient at filtration. Eventually, some capillaries scar and cease functioning entirely. This damage creates a destructive cycle. Damaged kidneys become less effective at regulating blood pressure, allowing pressure to rise further. Higher pressure causes additional kidney damage. Breaking this cycle requires intervention at multiple points, including medication, dietary modification, and lifestyle changes. Identifying hidden sodium sources. Reducing sodium intake requires awareness of where dietary sodium originates. The most effective approach involves distinguishing between sodium added during cooking or at the table, which accounts for a relatively small portion of total intake for most people, and sodium incorporated during food processing, which represents the majority. Processed foods typically contain sodium far exceeding what home preparation would require. Canned soups often contain 800 to 1,000 milligrams of sodium per serving, approaching half the daily recommended limit in a single bowl. Frozen dinners, even those marketed as healthy options, frequently contain substantial sodium as a preservative and flavor enhancer. Deli meats and cured products are preserved with sodium and contribute significantly to daily intake. Restaurant food presents similar challenges. Chefs season food throughout preparation, and final dishes often contain considerably more sodium than comparable home-cooked meals. Even dishes not perceived as salty, such as pasta with tomato sauce or grilled fish with seasoning, may contain substantial sodium. Salad dressings, sauces, and condiments add sodium in amounts that diners may not appreciate. Label reading becomes an essential skill for sodium management. Nutrition facts panels list sodium content per serving, but serving sizes on packages may differ from actual consumption. A can of soup labeled as containing 2 servings may be consumed as 1 meal, doubling the sodium intake from that item. Comparing products and choosing lower sodium versions of staple items reduces intake without requiring dramatic dietary changes. Potassium balance and kidney function. Potassium works in concert with sodium to maintain numerous physiological functions. Where sodium predominates outside cells, potassium predominates inside cells. This gradient across cell membranes is essential for nerve transmission, muscle contraction, and heart rhythm. The kidneys maintain this balance by excreting excess potassium while conserving it when intake is low. For individuals with healthy kidneys, the body can typically handle wide variations in potassium intake. The kidneys adjust excretion rates to maintain stable blood levels when kidney function declines. However, potassium regulation becomes impaired. Excess potassium can accumulate in the blood, a condition called hyperkalemia that can disrupt heart rhythm dangerously. Dietary potassium sources include many healthful foods. Fruits, particularly bananas, oranges, and melons, provide potassium. Vegetables, including potatoes, tomatoes, and leafy greens, contribute significantly. Beans and legumes contain potassium along with protein and fiber. For individuals with normal kidney function, these foods support health without concern. For those with reduced kidney function, potassium intake may require modification. This does not mean eliminating potassium-rich foods entirely, but rather balancing intake across the day and understanding which foods contain highest concentrations. A renal dietitian can provide specific guidance based on individual kidney function levels and blood test results. The diabetes connection. Diabetes stands as the leading cause of kidney failure, accounting for approximately 44% of new cases requiring dialysis or transplantation. Understanding this connection illuminates why blood sugar management carries such importance for kidney health. The mechanism of diabetic kidney damage, termed diabetic nephropathy, involves multiple pathways. High blood glucose levels directly affect kidney structure and function. Glucose molecules can bind to proteins in a process called glycation, forming compounds that accumulate in kidney tissue and trigger inflammatory responses. The kidneys attempt to filter excess glucose from blood, overworking the filtering units and subjecting them to stress. Blood vessel changes accompany diabetes and affect kidneys profoundly. High glucose damages the lining of blood vessels throughout the body, including those supplying the kidneys. These vessels become less flexible and more prone to leakage. The small arteries within the kidneys narrow, reducing blood flow to kidney tissue. Areas receiving inadequate blood supply cannot function optimally and may eventually scar. The earliest sign of diabetic kidney disease is the appearance of small amounts of protein in urine, specifically a protein called albumin. Healthy kidneys normally retain albumin in the bloodstream. When the filtering units become damaged, they begin to leak albumin into urine. This microalbuminuria, detectable only through specific urine testing, signals the beginning of diabetic kidney disease before overall kidney function declines. Blood sugar control directly influences kidney outcomes. Studies consistently demonstrate that maintaining blood glucose levels as close to normal as possible reduces the risk of developing diabetic kidney disease and slows progression in those who already have it. The hemoglobin A1C test, which reflects average blood sugar over the preceding 2 to 3 months, provides a useful measure of control. Generally, lower A1C levels correlate with lower kidney risk, though individual targets should be established with healthcare providers. Section 5. Sleep, breathing, and kidney health. The physiology of sleep and kidney function. Sleep is not merely a period of rest, but an active state of physiological restoration. During sleep, the body performs numerous maintenance functions that support health, including processes that affect the kidneys directly. The relationship between sleep quality and kidney function has gained increasing research attention, revealing connections that many individuals would not suspect. Blood pressure normally follows a circadian pattern, dipping during sleep and rising upon awakening. This nocturnal dipping provides the cardiovascular system, including the kidneys, with a period of relative rest. The lower pressure during sleep allows blood vessels to relax and recover from the demands of daytime circulation. For the kidneys, this means a temporary reduction in filtration pressure and workload. When sleep is disrupted or inadequate, this blood pressure pattern changes. Individuals who sleep poorly often show blunted nocturnal blood pressure dipping or no dipping at all. Their kidneys receive no nightly break from elevated pressure. Over time, this sustained pressure contributes to the same types of vascular damage seen in hypertension, even if daytime blood pressure readings appear acceptable. Sleep apnea and kidney stress. Obstructive sleep apnea represents a specific sleep disorder with particular relevance to kidney health. In this condition, the airway collapses repeatedly during sleep, interrupting breathing for periods lasting from seconds to more than a minute. These apneic episodes can occur hundreds of times per night, each producing profound physiological effects. During an apnea episode, oxygen levels in the blood fall. The brain detects this drop and partially arouses the individual to resume breathing, though the person typically remains unaware of these arousals. The combination of low oxygen and arousal triggers a surge of stress hormones, including adrenaline, which constrict blood vessels and sharply increase blood pressure. This cycle repeats throughout the night, producing repeated episodes of hypoxia and blood pressure spikes. The kidneys are highly sensitive to oxygen levels. They require a constant, adequate oxygen supply to maintain the active transport processes involved in filtration and reabsorption. Repeated episodes of low oxygen during sleep apnea can damage kidney tissue directly through hypoxia. The intermittent surges in blood pressure add vascular stress, compounding the damage. Research has documented higher rates of chronic kidney disease among individuals with untreated sleep apnea compared to those without the condition. The relationship appears dose-dependent. More severe apnea correlates with higher kidney risk. Importantly, treatment of sleep apnea with continuous positive airway pressure, or CPAP, has been shown to improve blood pressure control and may slow kidney disease progression. Improving sleep quality for kidney protection for individuals without diagnosed sleep disorders. General sleep hygiene practices support the restorative functions that benefit kidney health. Consistency in sleep schedule helps maintain circadian rhythms. Going to bed and waking at approximately the same times each day reinforces the body's internal clock, supporting optimal hormone secretion and blood pressure patterns. The sleep environment influences sleep quality significantly. A cool room temperature supports the natural drop in core body temperature that facilitates sleep onset and maintenance. Darkness promotes melatonin production, the hormone that regulates sleep-wake cycles. Quiet or the use of white noise to mask disruptive sounds prevents arousal from environmental noises. Evening routines affect sleep through multiple mechanisms. Exposure to bright light, particularly the blue light emitted by screens, suppresses melatonin and delays sleep onset. Stimulating activities, including intense exercise or emotionally charged discussions, can elevate stress hormones and interfere with relaxation. Heavy meals close to bedtime may cause discomfort or reflux that disrupts sleep. For individuals who snore loudly, wake unrefreshed despite adequate time in bed, or have been observed to stop breathing during sleep, evaluation for sleep apnea is warranted. Sleep studies, which can now be performed in the home in many cases, provide definitive diagnosis. Treatment, when indicated, can dramatically improve not only sleep quality, but also cardiovascular and kidney outcomes. Section 6. Supplements and kidney safety. The myth of natural safety. The perception that natural substances are inherently safe poses a particular risk to kidney health. Unlike pharmaceutical drugs, which undergo rigorous testing for safety and efficacy before market approval, dietary supplements operate under different regulatory frameworks. Manufacturers bear responsibility for ensuring their products are safe, but the regulatory agency does not review products before they reach store shelves. This regulatory difference means that supplement contents may not match label claims. Independent testing has repeatedly found supplements containing different ingredients or different doses than stated on packaging. Some products have been found contaminated with heavy metals, including lead, mercury, and arsenic, which accumulate in kidney tissue and can cause direct toxicity. The term natural provides no guarantee of safety for kidneys. Many plant compounds have potent biological effects, some of which include kidney toxicity. Aristolochic acid, found in certain herbs used in traditional medicine systems, causes a distinctive form of rapidly progressive kidney damage and increases risk of urinary tract cancer. Other herbal compounds may interact with medications, affecting how those drugs are processed and potentially increasing their kidney effects. Supplement risks for kidneys. The kidneys face unique risks from supplements because of their role in processing and excreting everything that enters the body. When supplements are ingested, their components enter the bloodstream and eventually reach the kidneys for filtration. Some compounds may directly damage kidney cells during this process. Others may form crystals that precipitate in urine, potentially obstructing tubules or forming stones. High-dose vitamin supplements illustrate this principle. Vitamin C, when consumed in very high doses, is metabolized to oxalate, which can combine with calcium to form kidney stones in susceptible individuals. Vitamin D, essential for bone health, can become toxic at excessive doses, causing calcium levels to rise and potentially damaging kidneys through calcification of soft tissues. Mineral supplements require similar caution. Calcium supplementation, particularly when taken without food or in forms that are poorly absorbed, can increase urinary calcium excretion and stone risk. Magnesium, while generally safe, can accumulate in individuals with reduced kidney function. Potassium supplements, as previously discussed, carry significant risk when kidney function is impaired. Herbal supplements present particular challenges due to their complex composition. Unlike single-ingredient pharmaceutical drugs, herbs contain multiple compounds whose effects may not be fully characterized. St. John's wort, used for mood support, affects liver enzymes that process many medications, potentially altering their levels and effects. Cranberry supplements, often taken for urinary health, can interact with blood-thinning medications. These interactions may indirectly affect kidneys by altering medication levels. Safe supplement practices. For individuals who choose to use supplements, certain practices reduce risk. Consulting healthcare providers before starting any supplement regimen allows for review of potential interactions and assessment of individual risk factors. Healthcare providers can also recommend appropriate doses, which may differ from package suggestions based on individual health status. Selecting supplements from reputable manufacturers provides some assurance of quality. Third-party testing organizations evaluate supplements for content accuracy and contamination. Products bearing seals from organizations such as USP, NSF International, or Consumer Lab have undergone independent verification of their contents. Avoiding products with exaggerated or sensational claims protects against particularly risky supplements. Products promising dramatic results or claiming to cure multiple unrelated conditions often contain undisclosed pharmaceutical ingredients or dangerous compounds. Similarly, products with vague ingredient lists or proprietary blends that do not disclose individual component amounts prevent informed decision-making. The principle of more is not better applies particularly to supplements. Larger doses do not produce greater benefits once nutritional needs are met and may increase toxicity risk. For most nutrients, the range between adequate intake and harmful intake is narrower than many people realize. Sticking to recommended doses, or lower, provides the safest approach. Section 7. Tobacco and vascular health. Direct kidney effects of smoking. Tobacco smoke contains thousands of chemical compounds, many of which enter the bloodstream and circulate throughout the body. When these compounds reach the kidneys, they exert multiple damaging effects. Nicotine and other smoke components constrict blood vessels, reducing blood flow to kidney tissue. This vasoconstriction compounds any existing circulation problems from conditions like diabetes or hypertension. The vascular damage from smoking extends throughout the arterial system. Atherosclerosis, the buildup of fatty plaques in artery walls, progresses more rapidly in smokers. When this process affects the renal arteries, which supply blood to the kidneys, the resulting narrowing reduces blood flow. Kidneys receiving inadequate blood supply cannot function optimally and may eventually sustain irreversible damage. Smoking also directly affects kidney cells through oxidative stress and inflammation. The chemicals in smoke generate reactive molecules that damage cellular components, including DNA, proteins, and cell membranes. The kidney's high blood flow and metabolic activity make them particularly vulnerable to this oxidative damage. Over time, the cumulative effect of this damage contributes to scarring and functional decline. Smoking and kidney disease progression. For individuals with existing kidney disease, smoking accelerates progression dramatically. Studies have documented that smokers with chronic kidney disease lose function more rapidly than non-smokers with comparable disease severity. This effect appears independent of other risk factors. Smoking adds risk beyond its effects on blood pressure and diabetes. Proteinuria, the leakage of protein into urine that signals kidney damage, increases in smokers. Higher levels of proteinuria correlate with faster progression to kidney failure. Smoking cessation has been shown to reduce proteinuria, indicating that some smoking-related damage may be reversible or that cessation allows healing processes to occur. The combination of smoking with other kidney risk factors proves particularly dangerous. A person with diabetes who smokes faces substantially higher kidney risk than a non-smoker with similar blood sugar control. A smoker with hypertension experiences more rapid kidney damage than a non-smoker with identical blood pressure readings. These multiplicative effects mean that addressing smoking provides outsized benefits for those with other risk factors. Benefits of cessation. The kidneys begin to benefit from smoking cessation remarkably quickly. Within days of stopping, blood pressure typically decreases slightly. Circulation improves as blood vessels regain normal tone. The constant vasoconstriction from nicotine exposure ceases, allowing more consistent blood flow to all organs, including the kidneys. Over months and years, the benefits accumulate. Inflammation markers in blood decrease. Oxidative stress diminishes. The progression of atherosclerosis slows to the rate seen in non-smokers. For individuals with existing kidney disease, the rate of functional decline often slows following cessation. Cessation resources have expanded considerably in recent years. Nicotine replacement products, available over the counter or by prescription, help manage withdrawal symptoms. Prescription medications can reduce cravings and make quitting more achievable. Counseling and support programs, available by phone, online, or in person, improve success rates. The combination of medication and counseling provides the highest likelihood of successful cessation. Section 8. Blood pressure management. Understanding the kidney hypertension connection. The relationship between kidneys and blood pressure operates as a bidirectional feedback system. The kidneys both influence blood pressure and are damaged by elevated pressure. Understanding this connection illuminates why blood pressure management stands as a cornerstone of kidney protection. The kidneys regulate blood pressure through multiple mechanisms. They control the volume of fluid in the bloodstream by adjusting how much water is excreted in urine. They release renin, an enzyme that initiates a cascade leading to blood vessel constriction and sodium retention. They produce substances that can either dilate or constrict blood vessels. Through these mechanisms, healthy kidneys maintain blood pressure within a relatively narrow range despite variations in salt intake, fluid consumption, and activity level. When blood pressure remains elevated, these regulatory mechanisms become strained. The constant high pressure damages the delicate filtering structures. Damaged kidneys become less effective at regulating pressure, leading to further elevation. This vicious cycle underlies much of the progressive nature of hypertensive kidney disease. Treatment approaches and kidney protection. Medication treatment for hypertension has evolved considerably, with recognition that some blood pressure medications offer particular benefits for kidney protection. Angiotensin-converting enzyme inhibitors and angiotensin receptor blockers, two related classes of medications, not only lower blood pressure but also directly reduce pressure within the glomeruli, the filtering units. This intraglomerular pressure reduction protects nephrons from the mechanical stress that leads to scarring. These medications work by blocking the effects of angiotensin II, a potent vasoconstrictor that also promotes sodium retention and inflammation. By reducing angiotensin II activity, these drugs dilate blood vessels throughout the body and specifically within the kidneys. The result is lower systemic blood pressure and reduced filtration pressure within the glomeruli. For individuals with diabetes, these medications provide kidney protection even when blood pressure is not significantly elevated. Guidelines recommend them for diabetic patients with evidence of early kidney damage, as their pressure-lowering effects within the kidney appear beneficial independent of their systemic effects. Adherence to prescribed medication regimens proves essential for kidney protection. Blood pressure medications control but do not cure hypertension. When medications are stopped, blood pressure returns to pre-treatment levels. The kidney damage that was being slowed by treatment resumes its previous pace. Regular monitoring and consistent medication use maintain the protection that treatment provides. Monitoring and targets. Regular blood pressure monitoring provides the feedback necessary for effective management. Home monitoring, using validated automated devices, offers advantages over occasional office readings. Multiple readings taken under consistent conditions provide a more accurate picture of usual blood pressure than single measurements in medical settings. Target blood pressure has been refined through research. For most individuals, a target below 130/80 millimeters of mercury provides optimal kidney protection. Individuals with diabetes or known kidney disease may benefit from even lower targets, though individual factors influence optimal goals. Establishing appropriate targets with healthcare providers ensures that treatment aims for appropriate levels. Lifestyle measures support medication effects and may reduce medication requirements. Sodium restriction, as previously discussed, enhances the effectiveness of many blood pressure medications. Regular physical activity helps lower pressure through multiple mechanisms. Weight management, when needed, reduces the workload on the cardiovascular system. These measures complement medication rather than replacing it for most individuals. Section 9. Protein intake considerations. Protein metabolism and kidney workload. Protein metabolism produces nitrogen-containing waste products that must be eliminated from the body. When protein is broken down, amino acids are stripped of their nitrogen-containing components, which are converted to urea in the liver. This urea enters the bloodstream and travels to the kidneys, where it is filtered and excreted in urine. For individuals with healthy kidneys, this process proceeds efficiently regardless of typical variations in protein intake. The kidneys possess considerable reserve capacity and can increase filtration to handle higher urea loads. This reserve explains why high-protein diets do not cause kidney disease in individuals with normal kidney function, when kidney function is already compromised. However, the situation differs. Each nephron's filtering capacity is fixed. When total nephron numbers decline due to disease or aging, the remaining nephrons must filter more to maintain overall function. This hyperfiltration stresses those remaining nephrons, potentially accelerating their decline. High protein intake, by increasing the urea load requiring filtration, contributes to this hyperfiltration stress. Protein needs at different kidney function levels. Protein requirements depend on kidney function status. For individuals with normal kidney function, standard protein recommendations apply, generally 0.8 grams per kilogram of body weight daily for sedentary adults, with higher amounts for those who are physically active or recovering from illness. These amounts support tissue maintenance and repair without imposing excessive filtration demands. For individuals with diagnosed chronic kidney disease who are not on dialysis, protein intake may need modification. Lower protein diets reduce urea production and decrease the filtration burden on remaining nephrons. The degree of restriction depends on kidney function level, with more advanced disease generally requiring greater restriction. These diets must be carefully planned to ensure adequate nutrition while reducing workload. For individuals on dialysis, protein requirements actually increase. Dialysis removes waste products but also removes amino acids and small proteins. Additionally, the dialysis process itself creates a catabolic state, increasing protein breakdown. Protein recommendations for dialysis patients typically range from 1.2 to 1.4 grams per kilogram daily, substantially higher than for those with normal function. Processed meat considerations. Processed meats deserve special mention due to their multiple effects on kidney health. These products, including bacon, sausage, deli meats, and hot dogs, contain high levels of protein but also contain substantial sodium and preservatives. The sodium content adds to the kidney's workload through blood pressure effects. As previously discussed, phosphorus additives in processed meats present additional concerns. Many processed meats contain phosphate compounds used as preservatives, flavor enhancers, and texture modifiers. These inorganic phosphates are more readily absorbed than natural phosphorus found in whole foods. for individuals with reduced kidney function, who cannot efficiently excrete excess phosphorus. Accumulation can occur. High phosphorus levels contribute to vascular calcification and bone disease. The combination of high protein, high sodium, and added phosphorus makes processed meats particularly problematic for kidney health. Even individuals with normal kidney function may benefit from limiting these foods, while those with known kidney disease should approach them with particular caution. Section 10. Prevention through monitoring. Key kidney function tests. Early detection of kidney disease requires specific testing, as symptoms do not appear until substantial function has been lost. 3 primary tests provide the information needed to assess kidney health. Blood pressure measurement, estimated glomerular filtration rate from blood testing, and urine albumin measurement. Blood pressure measurement, while simple, provides essential information about a primary risk factor for kidney disease. Readings above 130/80 warrant attention and management. As previously discussed, regular monitoring, at least annually for most adults and more frequently for those with risk factors, identifies hypertension early when intervention is most effective. Estimated glomerular filtration rate, or eGFR, is calculated from blood creatinine levels along with age, sex, and sometimes race. Creatinine is a waste product from muscle breakdown that healthy kidneys filter completely. When kidney function declines, creatinine accumulates in blood. The eGFR calculation translates creatinine level into an estimate of actual filtration capacity. Normal eGFR is typically above 90, though values decline normally with age. Values consistently below 60 indicate chronic kidney disease. Urine albumin measurement detects kidney damage at its earliest stage. Healthy kidneys retain albumin in the bloodstream. When the filtering units begin to leak, small amounts of albumin appear in urine. This microalbuminuria often occurs before eGFR declines, providing an opportunity for intervention before substantial function is lost. Urine albumin is typically measured as a ratio to urine creatinine to account for urine concentration variations. Understanding test results. Test results require interpretation in context. A single abnormal value does not necessarily indicate disease. Transient factors can affect both blood and urine tests. Confirmation through repeat testing provides more reliable information. Trends over time offer more useful information than individual values. eGFR below 60 for 3 months or longer confirms chronic kidney disease diagnosis. Staging from 1 to 5 reflects severity, with stage 1 indicating kidney damage with normal filtration and stage 5 indicating kidney failure. Staging guides treatment decisions and monitoring frequency. Higher stages require more intensive management and more frequent monitoring. Urine albumin results are reported as categories: normal, moderately increased microalbuminuria, and severely increased macroalbuminuria. Higher albumin levels correlate with faster progression to kidney failure and higher cardiovascular risk. Reduction in albumin levels through treatment predicts improved outcomes. Establishing a monitoring schedule. Monitoring frequency should reflect individual risk. Adults over 60 with no known risk factors should have blood pressure checked at least annually and may benefit from periodic kidney function testing, though guidelines vary. Those with diabetes, hypertension, or family history of kidney disease require more frequent monitoring, typically annually at minimum. Individuals with diagnosed chronic kidney disease require monitoring at intervals determined by disease stage and progression rate. Stable early-stage disease may be monitored annually, while more advanced or rapidly progressing disease may require quarterly or even monthly testing. This monitoring guides treatment adjustments and timing of preparation for kidney failure if it occurs. Home monitoring supplements medical testing for some individuals. Home blood pressure monitoring provides more frequent data than office visits alone. Some individuals with diabetes perform home urine testing for protein, though this is less sensitive than laboratory testing. These home measurements, when recorded and shared with healthcare providers, enhance the information available for treatment decisions. Summary of protective practices. Protecting kidney health after 60 involves multiple interconnected practices, responding promptly to urinary urges and ensuring complete bladder emptying prevents infections that can ascend to the kidneys. Using pain medications judiciously, at the lowest effective doses for the shortest possible durations, avoids medication-related kidney stress. Maintaining consistent hydration throughout each day supports all kidney functions while reducing stone risk. Dietary choices significantly influence kidney health. Limiting sodium from processed and restaurant foods controls blood pressure and reduces filtration stress. Moderating sugar intake, particularly from sweetened beverages, prevents the blood sugar elevations that lead to diabetic kidney disease. Balancing protein intake according to kidney function status ensures adequate nutrition without overloading filtration capacity. Addressing sleep quality, particularly by evaluating and treating sleep apnea, reduces nighttime blood pressure surges and oxygen desaturation that stress kidneys. Avoiding tobacco entirely eliminates a major source of vascular damage and oxidative stress. Managing blood pressure through medication and lifestyle, with attention to medications that specifically protect kidneys, slows or prevents hypertensive kidney damage. Using supplements cautiously, with medical guidance and from reputable sources, prevents unintended kidney toxicity from natural products. Regular monitoring through blood pressure checks, blood tests for creatinine, and urine tests for albumin detects problems early when intervention is most effective. These practices, implemented consistently, support kidney function throughout the later years. While some age-related decline in kidney function is inevitable, the rate and extent of decline depends substantially on modifiable factors. Attention to these factors preserves kidney function longer, maintaining quality of life and avoiding the devastating consequences of kidney failure. The single most important truth to carry forward from our time together is this. Your kidneys ask for nothing dramatic, only consistency, only attention, only the quiet respect of not being taken for granted. The small choices we have explored, the ones that seem insignificant in isolation, accumulate across decades into either resilience or decline. Perhaps you recognized yourself in some of these habits. Perhaps you saw a parent or a friend or a spouse. That recognition is not meant to produce guilt, but clarity. And clarity, when it is honest and complete, has a way of quietly transforming what comes next. If something we discussed today stirred a thought or raised a question you would like to explore further, we would be honored to hear your reflections in the comments. The Longevity Library holds many volumes, and if you have not yet seen the other recordings we have assembled, we invite you to browse the shelves and return whenever you seek understanding. Until then, take good care of the body that carries you through this world. This is the Longevity Library. Listen, learn, and live longer.